spoke about the damaging effects of not using an electric toothbrush, which was quite interesting. And I didn't want to, haven't done my research, because you're doing so many research in so many areas. But let's talk about the electric toothbrush. What Dr. Thomas Levy and who was a doctor, I'll think of him now, who's been on my podcast, incredible, showed me about hydrogen peroxide nebulization and using hydrogen peroxide in a water flosser. So I'm just putting these on your radar now in terms of oral hygiene because people are going to be listening, and then obviously not using fluoride toothpaste. But let's talk about just oral health. Someone's listening and saying, okay, what should I do? Should I use an electric toothbrush? Should I use a water flosser? I use a water flosser with hydrogen peroxide in. I think that's been incredible. But give us Dr. Michelle's sort of protocol.
Yep. So really it's going to get to root cause. What causes dental disease? What causes tooth decay? What causes gum disease? What really causes all of this? So tooth decay, there are two causes. Unfortunately, the only one that we usually talk about is the first one you just did,
Mm,
which is toothbrushing, tooth products, actual things you're putting in the
mm,
mouth. That is one cause. We need to address the other one too, but let's talk about that one
mm,
first. So really, there are no magic bullets here. You just have to get the plaque off the teeth because what causes the cavity is acid. Now, sugar doesn't cause a cavity. Sugar in the mouth, bacteria eat it. And the bacteria, for lack of a better word, they poop out acid. So they eat sugar, they poop out acid. That acid dissolves minerals in the tooth. It's just like if you were pour Coke over top of like a battery terminal on a car battery, it dissolves all of those minerals. So the acid from the bacteria or from your mouth or from your diet. So if you're drinking, swigging, soda and energy drinks, this is a big problem in the United States. If you're coating your mouth with acid, all that acid dissolves minerals. And your teeth, the enamel, the part that you see, is highly mineralized. It's just made of a compound called hydroxyapatite. So you put acid on it, it's going to pull the minerals out. It's going to leave holes where those minerals came from. It's really simple.
mm,
Bacteria then crawl into those holes. They eat more sugar, they poop more acid, and they dissolve more minerals, or more soda or energy drinks get into those
mm.
holes and dissolve the minerals further and further and further. As the bacteria crawl in, you now can't get the bacteria out of those holes anymore, the deeper it goes. So this is why you actually can heal a cavity when it's on the outside layer, because it's just a lack of minerals. You can fill that tooth back up with minerals, get the bacteria off of there, clean them real nicely, fill that up with minerals, and you actually can heal a cavity if it's in the mineral layer. Once it's into the deeper layer, those little feeder tubes I talked about earlier, those bacteria are spreading. It's kind of like a super highway and they go real quickly. So usually once it's into that deeper dentin layer, we're saying go to the dentist, get it filled. When it's in that outside layer, use hydroxyapatite. It's the mineral your teeth are made of. There's now tooth care products. There's tooth powder. I have a tooth powder. I have a new toothpaste coming out in a week. All of these things have hydroxyapatite, literally just the stuff your teeth are made of. So does it matter if you use a manual toothbrush or an electric toothbrush? It matters more how well are you cleaning. Now, typically in most people's hands, an electric toothbrush is going to be more effective. You're going to get into the nooks and crannies better. So it's less which one is better and it's more how do they clean. So if an electric toothbrush will get to places that you don't, will do a better job than you do with just your hand motion, then please use an electric toothbrush. If a water flosser will get into nooks and crannies that you can't, then use a water flosser. It's just about getting those bacteria off of the teeth
Mm.
because if they stay there, they're going to be dissolving minerals and it's going to lead to either tooth decay or gum disease because bacteria also drop all of their, I like to think of it garbage. They drop their garbage all over the gums and the gums start to pull back. They say, oh, that's bad stuff up there. I got to get out of the way. So hydrogen peroxide's awesome. Why?
Yeah.
Because it's oxygenating those bacteria that don't like oxygen, the bad dudes that are hiding in those real deep areas.
Mm.
Hydrogen peroxide's oxygenating and wiping them all out. So again, what you want to use is something that's going to do a good job. Use an electric toothbrush if you need it. Use hydroxyapatite tooth products. Use use hydrogen peroxide if necessary. I love colloidal silver also.
Mm.
Colloidal silver is also a very good liquid for putting in the mouth and killing bugs where they shouldn't be. So those are all things that I will use to clean the mouth and recommend to clean the mouth. You just need to have your teeth clean.
Sure.
That's
Okay.
one side.
Yes. Go for the second.
Second side is cavities also come from the inside.
Mm.
So, if your body needs more minerals than it currently gets, either through diet or because you have gut absorption issues, your body will sacrifice the teeth to feed your brain, your heart, your other systems and organs that are essential for life. Because guess
Mm.
what? You can actually live without your teeth. Your body knows this. I was telling you before we got here, I just got back from a trip to Morocco. I've never seen worse teeth in my whole life. Oh my gosh, the teeth there are horrendous. Why? Well, I think it's two reasons. They love mint tea with a lot of sugar, so they're bathing their teeth in the sugar that the bacteria love. And number two, I don't think they're getting all the minerals and nutrients they need on the inside
Mm.
either. So their body's stealing minerals from their teeth. So this often happens when people are pregnant or teenagers or some of these other times that have, if you think about it, a teenager's growing bones, right? They're growing their own bones, like they're growing taller, longer, all those things. Pregnant woman is growing bones and teeth, right? And the
Yeah.
baby. High demand for minerals. So if your body is not getting enough minerals, it will steal it from the teeth. And I'll
Sure.
see perfectly clean teeth that are getting cavities. So you have to feed your body minerals as well to combat tooth decay. It's
Mm.
not all about brushing.